We got to speak to a couple at the Coast General Hospital who were gracious enough to speak on camera, yet the man was on oxygen support. At the Coast General Hospital in Mombasa, we gained exclusive access into the COVID-19 isolation wards. But first, we had to dress for the occasion, get ready to get into the battle zone. On any other day, this lady would be going about her work in the hospital as a nurse, but she is on the other side of the situation. The alarm came when her husband started feeling unwell and was admitted at the Aga Khan Hospital, Mombasa. He then continued to have trouble breathing, and they both underwent COVID-19 tests.
After 2 days, the Aga Khan Hospital called me, and they told me we are transferring your husband to Coast General. Even without any further ado, I already made my conclusions. I knew the COVID test was positive.
They came to learn that she is the one who initially contracted the disease while at the hospital after coming into contact with an asymptomatic carrier. She then went home, and her 61-year-old husband also got infected, while his wife is asymptomatic. He is among the 3 patients admitted at the intensive care unit. He has underlying health conditions and is receiving oxygen through a high-flow nasal cannula, which supplies more oxygen than a ventilator.
It's so bad. Wow.
Feeling better.
Better.
Yes.
Far much better.
There are people out there who feel that this disease, that coronavirus, is not real. What can you tell those people?
These people, they are very wrong. This disease is very real. And they don't have to joke with it. But it's very real.
COVID is real. I myself, I have tested it. And it's not a joke. But I'm not sending out fear, but I'm sending out a word of precaution. But let's be careful and take care of one another, especially our families.
Do you still have a difficulty in breathing?
If I change, they all fit so much.
His wife requested to be in the same ward as he is so that she can take care of him, exemplifying the sections of wedding vows that say, for better or for worse, and in sickness and in health.
Luckily, this patient, who was saturating at 65%, has now stabilized and is saturating at 93%.
He looks forward to joining this other recovered COVID-19 patient. Anderson Bongo, who recovered after 26 days of treatment, was discharged after testing negative for the virus. He says he spent 3 days in the ICU after developing respiratory distress.
Maisha ya ICU ni magumu kwa sababu uko katika kitanda chako, alafu hapo karibu yako mtu anaaga, ama hapo karibu yako mtu hali yake ni mbaya sana. Kwa hivyo uko pale lakini tu uko katika hali ambayo nitasema sijui ni wasiwasi.
This lady patient, who is also a nurse, says that there is need to further support healthcare workers such as herself.
I would like to send this to our government that it's good that we have PPEs for the other staffs, especially those who are working in casualty, the wards everywhere, because they are dealing with patients they don't know, who are maybe asymptomatic, or those who are already symptomatic, but before they are confirmed, those nurses, doctors, all the people working in the hospitals are exposed.
Some of the things we saw in there are easily life-changing.